Hola, buenos días.
Hello, everybody. It's a pleasure to have everybody here today.
Por aquí.
Okay.
Just in case you don't understand what I was
Vamos a
saying,
tener una
we are
traducción
having
simultánea de español a inglés.
translation from Spanish to English. In the interpretation
Pueden
channel,
escoger inglés o español
choose English or
y
Spanish,
podrán
and you will
escucharlo
be able
en el idioma que
to
prefieran.
listen to it in your preferred language. Nos da mucho gusto poder contar con todos ustedes participantes aquí
It's a pleasure to have everybody here in our Latin America panel.
sobre Latinoamérica.
We created this panel with a very important purpose for us, which is bringing the researchers closer to academia, to what is happening in the real life in the Latin American context, what's happening with the context with COVID. This goes to practitioners, to professionals who are working in international organizations, in the public sector, in ONGs, different projects that have direct contact with the Latin American reality. This is very welcome, especially for research that has social or positive impact. When we want to have research that has an impact on public policies, because public policies are those which put people at the center. To achieve this, which is very important, we must know what is happening with these citizens, with these families, because there's stories behind every one of them, and very specific needs as well. So this panel will give us a very interesting perspective on what has been happening in Latin America. Obviously, this is not the entire perspective, but it's an overview of what is happening. And it will also open the door for us to find academic solutions to the different problems. So welcome to this panel, this space. I want to introduce some of the people who are with us today. Betica Muñoz Pogosian. She's director for the Inclusion Department in the OEA. She has a PhD in political science from the Florida International University. She's a master in international relations from the University of South Florida. We're also going to introduce Nancy Romaldo. She's a professional from the Universidad Nacional Mayor de San Marcos with a focus on social projects. And during the last 8 years, she has worked as a coordinator for projects in social projects in Peru. She's going to tell us about the projects she's been working on. Welcome, Nancy. The next person is... I'm rushing a little bit because we know we have a very tight schedule. Rocio Maciel, she's a general director for human rights, the legislature of Buenos Aires. She works with the party Coalición Cívica and Together for Change, Juntos por el Cambio. Studied in the University of Buenos Aires and has worked as a consultant for human rights. Finally, we have Juan Manuel Arribas Berenson. He has more than 22 years in strategic planning for social responsibility and communication. He has directed important projects. He's currently director for business solutions against poverty, Hombro a Hombro. It's a movement led by entrepreneurs, which has had an important role during the pandemic in the fight against COVID-19. They have offered more than 6 tons of human relief. Thank you to all our panelists. Thank you for giving us some of your very tight schedule to us. And we will start with the first question that we have in the panel. And the first question for each one of you is, what has been the role that you have led within your organizations in this COVID-19 pandemic. We will have about 5 minutes for each one of you to answer this question. We can start in the order we presented you. Excellent. Thank you very much, Christian, for this introduction and for the invitation to this this important talk to connect theory with practice. So thank you for so I'm representing the OEA, which is an organization, a multilateral organization in the hemisphere, with 35 member states in the organization, focused on democracy, security, development, and human rights. Throughout the pandemic, of course, it became in a space for help and to find challenges and solutions within two perspectives. Politically, of course, with all the governments of the region, we agreed to solve issues such as what are the main affected populations by COVID-19, what are the public policy answers to solve these issues, and some of the most hot topics has been the just distribution of vaccines, under the understanding that there must be equality in such distribution within countries and within countries. So this has been an important part of the discussion. From my role as Director of Social Inclusion, in his secretariat focused on human rights in rural areas, we have given visibility to very vulnerable populations, such as informing how COVID doesn't affect equally a person from a certain country compared to an immigrant who will be much more affected by COVID. For example, an immigrant tends to live in very close quarters, small areas, just in order to save money so they can send money to another region, or because they depend predominantly from informal markets, or for instance from men versus female, all the violence or domestic cases of violence were much more important for with women than with men. Situations such as these were release and escape. So for the aggressors. So COVID led to these cases. So we mapped out all these cases, and I would focus specifically with one result, which is a practical guide of inclusive answers focused on human rights, in which we established specific cases and guidelines for public policy to protect these populations, so such as African Americans, immigrants, LGBT, men, women, children, older people. And to close, because my initial time is running out, the main posture we make, because we're an organization that works with governments that have a responsibility to design initiatives, programs, projects, public policy that affect or that have a massive impact, which is an advantage of working with governments, because the work we do, we know, has a greater impact on people. The main message, or what we always try to focus on in these situations, which are still affecting us all in the region, is to try to design public policies with three main characteristics: focused on human rights, focused on equality and non-discrimination, and focused on intersectionality. When we talk about rights, we refer to the OEA being defenders of norms that defend human rights. And to have a public policy focused on human rights means looking at these norms that protect rights and aligning our responses to achieving these goals, to these rights. We can talk about this later on, But we do have that goal of translating what is on paper into our everyday lives. Focusing on equality and non-discrimination means making visible the differences of how people lead these crises, how people benefit from public policies when designing them. And finally, on intersectionality means recognizing that one person can have multiple identities that add or subtract rights or access to rights. So in a very fast, broad summary, that is what we do during the pandemic. Thank you for your participation and for the role you have on your Latin American context in the COVID crisis. We're also going to talk about what they have been doing during this time. Hi, and thank you everyone for the invitation or for the opportunity of talking about what our social health partners have been doing during the pandemic in 2021. Socios en Salud is a partner of Partners in Health in Peru, and they have 4 main lines. Mental health, sicknesses that are non-transmissible, and I missed that last one. She currently works in a place, in a project called Casitas. For everyone, COVID was definitely a pause in all of the activities that we were carrying out. And the goal of Socios was always to offer help to the most vulnerable population. This pause that we had during the pandemic was at the moment a challenge, but it was also useful to assume a role of initiative, of having interventions that we already have planned and adapting them to a virtual context, given that the measures that the country took towards this pandemic, such as quarantine, led to this. That is how, leading this project that I have, we try to adapt a physical intervention with scientific evidence, which has been running since 2013, and which tries to identify the population with 10 or less years with development problems. The first questions were, where are these people? Who are these people? How can we find them? How can we identify them? How is their situation? Let's not forget that kids and their health depends on their entire environment or context. Furthermore, such as Betile said, it was very noticeable that the context lived within the family could even be toxic for a kid. Stress on mothers increased, problems in the houses increased. There was no access to healthcare, so that's what happened throughout this context that we will speak about further along. In this context, we could adapt this intervention. We designed a chatbot that allowed us to identify the population through learning where the kids were located, links that were rapidly spread throughout the population using WhatsApp or social media. Another important goal was adapting our educational materials to share with all the caretakers throughout this experience. And that was very important because we involved the entire family that could be involved at that given time, such as parents, fathers, brothers, second caretakers, main caretakers, so they could also help with the early care of children and their health. That is basically the work we were doing throughout the pandemic. It was very important to identify high levels of depression in parents, male parents. Even with the problem of COVID, some families did not respect the quarantine or even left their homes to socialize, especially because they had very strong socioeconomic needs. So we had to work very integrally, focusing on the kid, but also and all the factors that they could be around the family, maybe depression in the caretaker, providing some sort of socioeconomic help, providing medical help to the family through telemedicine, remote medicine. It was very important for the organization to identify the population that was most being affected. We work with the regional director to identify cases that could be at risk of COVID and provide protection kits and offer constant care to prevent any spread of the virus throughout a family. So those were the main goals or main achievements we obtained. I have 1 minute left, so I do want to talk about mental health, something that also started to massively in these pandemic times being an issue. We work with different institutions, and we also created a group of chatbots to counter depression in people older than 18. And through teleguiding or remote guiding, providing them care. That's what I could say about what we've been doing throughout the pandemic. Excellent, Nancy. Thank you for telling us what you've been working on with children in the context of COVID-19. Our audience can, if they have any questions, leave them in the comment section for our Q&A chat. We'll be checking them to answer them throughout the panel at the end. We'll now present our next panelist. She's Rocío Maciel, and she's from Buenos Aires. Welcome, Rocío. Thank you for the invitation, Christian. Thank you, everyone who's participating. While I was listening to Batilde and Nancy, I was thinking how many things unite us in Latin America. It may seem that we're all in our home country, but much about what was talked about by Batilde and Nancy, and we're also living in Buenos Aires and in Argentina. As you said throughout your presentation, 2019, I became General Director of Human Rights in the legislature of the city. That was in 2019. We had 3 months of in-person work, then the pandemic hit. And we had the challenge of seeing how we were going to work to continue with our labor. In that sense, we focused a lot on observation, on watching on what was human in terms of human rights throughout the pandemic, but especially with quarantines. In this sense, in this moment, we noticed much about what was talked about by Batilde and Nancy. Gender violence throughout this period increased. It was a year with most femicides in Argentina, in the history of Argentina, derived from everything they were talking about. Quarantines, with houses being insecure. Another of the issues that appeared had to do with mental health, as mentioned by Nancy. Let's take into account that everything that was 2020 in Argentina, kids were 7 to 8 months without classes, without a single day of class in person. So that obviously led to sociability issues. Friendships were broken between kids. It caused thousands of problems to adolescents. As a specific sector that we're talking about, so that was an issue for our public sector policies. In this sense, it clearly caused not just an educational crisis, but also an emotional crisis and mental health crisis. One of the issues that also helped us to create liaisons with civil society was the abrupt fall of donations in Buenos Aires. It's a place where people tend to do blood donations. It fell 80% because hospitals became insecure. So what we did there, along with civil society, was finding other places that weren't hospitals. That is how we gave a new sense to school, a new purpose to cultural centers, to libraries, to clubs. We used those places that people could go to donate their blood. That was, I think, the context of this panel is a symbol that when there's a liaison between civil society and the state, public policy can have truly a change. It can change and have a true social consequence, which is what we're always striving to achieve in government departments. So having an impact on society. It's a small example, but I think it's important to bring it to your attention in this panel. I don't want to exceed my time. I think I have 1 minute left. But another of the topics that I think is important to note is how the legislature of the city was going to work regarding legislators, how they gathered to keep legislating and carrying out solutions for the population. The City of Populations was the first Argentinian parliament that could have a session, and they found a way to have sessions mixed, which was in person and in virtual. So presidents of blocks were in person, and the other voters voted from their homes. It's not a minor topic because we had to create new systems to achieve that function within the state. And we worked on this very quickly because it was very important for legislators to be able to gather, to talk, to give solutions to business people, to everybody, to agriculture, to education. The city of Buenos Aires was the first one to reopen schools, the first one that gave an answer to commercial businesses, so the economy didn't die in Buenos Aires. And I don't want to keep exceeding my time, so I'll wait for the next questions. Thank you very much. Thank you, Rocio, for your intervention and that vision of what was happening in Buenos Aires throughout COVID-19 and all the challenges it represented for Buenos Aires. We'll now go with Manuel Arribas Benson. Welcome, Juan Manuel. Thank you, Christian. A pleasure to be here, and thank you for the invitation. I'm a founder and current executive director of the poverty organization, a combat organization. It was born with the purpose of designing and executing public policies based in evidence, with the know-how of the private sector to make things happen, with the ability and the management that private sector has. Our initial work had an excellent work with organizations. We had more as a think tank. We intend to be. We have proven throughout our pandemic sessions. We've worked in the Amazons to establish a nutrition program in the Amazon. That's very big. We've been with the Minister of Education. We've restructured logistically in the ministry. We've been with Centrum, with the Social Progress Index. We've been in different sectors of the state. But in terms of the disasters, we've just been tending to this issue since 2017, when El Niño affected terribly our country. There was no organization in the private sector that could consolidate all the sector to centralize operations, share information, and make help more efficient. That is why with the state, there were some organizations that were responsible, but invisible towards the very government. As we say in my home, we jumped on to this issue in 2017 without knowing how to read or write in terms of disaster intending to this issue. Working with entrepreneurs was very natural and easy for us. Taking leadership from or leading the private sector to work with the state to coordinate, and we must have done a good work because the Ministry of Defense named us as representatives of the entire private sector in the operation for emergencies. This was very important. It caught the attention of important companies in the country, and they asked us to manage within our organization a new business front towards disasters, to be much more anticipatory with our responses to disasters and not rushing at the last minute to try to solve and coordinate with actors. That is how the organization Shoulder to Shoulder, Hombro a Hombro was born. It was proposed as an answer to the earthquake in Peru. We have a threat of an earthquake in Peru. We're expecting an earthquake rated 9, with about 200,000 death peoples expected, in a city with 10 million people, without water, without airports, without highways. That would be, frankly, hell. But we never thought of a pandemic such as this one, this scale. So what we did was rapidly adapt our response, our earthquake response, to a pandemic response. And we took all the help of the private sector within this civil society organization, worked with the armed forces to create food kits for families of 4 this time. It was immediately clear that our commitment had to expand to much more than in response to disasters, because in the end, to this day, we have achieved to transport over 6,000 tons of food and beverages, delivered to more than 600,000 people in very vulnerable conditions. We've brought the first batch of 1 million vaccines to Peru, so that's how we started with this vaccination process in the country. We have implemented over 20 plants or factories for oxygen, for healthcare. We have donated over 42 regulators of high-pressure regulators that in Peru we call guairachis. We proved that our hypotheses or work hypotheses, that teamwork with the state and the private sector works, despite the enormous distrust, mutual distrust between the state and the business sector. Never before in the history of Peru had there been such a level of coordination and support. Dr. Arellano, a market researcher in Peru, said that the internal gross market grew 4 times as greater, percentually wise, compared to the United States. So I will complement this information further on in the panel. Thank you, Juan Manuel, for your intervention, your great work you've done with Hombro a Hombro throughout the pandemic and offering help and throughout this pandemic, these times. We're a little short in time. We're a bit of a sandwich. We're caught in between 2 panels. We're going to do something that's very interesting. We're going to join the last 2 questions. What have been the great challenges that you have faced? And how do you think that academia could help to solve them? We're going to start in the same order with Tilde. And we have 3 minutes to answer this question. I'm going to take care of my time just to make sure I don't exceed my time. I think we've talked about or starting to map out the challenges. As an additional commentary and what involves my work specifically, the virtual world, which has been mentioned by Rocio and Nancy. Our Latin America has very big technology gaps. So this idea that we can all study online, that we're all connected and coordinated, is not always true. It's a key issue. Financing is also an issue. We work with donors for our projects. And of course, Latin America, 2020 had a negative growth in donations. In 2021, there's about a 3 to 4% growth in donations. There's a bounce back. But it's not enough to place the region where it was before in 2019. So that also has consequences when working on projects and deciding public policy from the point of view of the government. So there's greater needs and there's the same budget, government budget. And the third issue, which I already referred to, and I think Nancy mentioned as well, which is a great challenge for the region throughout the pandemic, is poverty, which is going to increase. We'll have new people in poverty. Food insecurity. Nancy gave us a vision of Peru, but it's also seen in Haiti, in Venezuela, in the entire hemisphere. In Guatemala, Honduras, and El Salvador, that is also going to be a huge issue, a massive issue for Latin America. What can academia do to solve this? Continue to generate data. The countries in the region have been building good information infrastructure, but it's still too low for the needs and the degree that we need to take better public decision policies, public policy decisions. Analyzing solutions, especially this focus on building scenarios, which is very useful for people who are making public policy at a technical and a leadership level. And third, the research that is generated should not remain in cabinets. It should not remain in a conversation between academics. It should transform into data, into information, into policy papers that are easy to digest. And not because government people don't have a good degree of education, but because of the people in public policies don't always have the time to process all the research and information. So it's key to transform these content into useful information for people who decide on public policy so they can have an impact in our reality. That's what I would say about this issue. Thank you, Beltile, for your information. Excellent data. Thank you, Chris. What we could work on is implementing or experiences. One of our greatest challenges, it was access to social media, to the internet. It's a great issue, especially in rural areas, in urban areas. However, I consider it's also important to involve the civil society in everything that we can adapt. Although the challenge is how to adapt something that we were already doing, which is proven to work, that our interventions could reduce issues. Taking it to a pandemic context with a population that has different needs at that time became a great first challenge. As I mentioned in my first intervention, we didn't know who they were, where they were, how we could reach them. We lost a lot of population which had been previously contacted. That was a great difficulty that up to this day we are trying to solve. But there's definitely populations that we're not reaching. Imagine that this is also true for other institutions. We have to find a way to solve it. That's why we innovated with chatbots. It's a way to reach different regions. But if they don't have an internet package, if they don't have a paid internet service on their phones, well, that's going to be an issue. We also work with strong community agents. They are our right arm in our projects, and they are responsible for delivering interventions to populations. They're not just support people or help me with something very specific, but they have a key role as actors. Imagine the challenges of this previously being an in-person training, and now we have to transform the entire dynamic with many of our agents, and many of our agents are older people, so they're not so fluid or adaptable to Zoom and WhatsApp. So all of that meant a training process of empowering this population to make sure that it was them who can reach the population and also help us gather information from the communities. Because I can organize my project from my table, but if you don't have evidence from the community, there probably won't be any medium or long-term results. So when talking about science, I am very pro implementation based on evidence. We can gather that information and scale it up. Evidence is something that in academia has to always consider and implement based on involving actors in the community. That is basically what I would like to share. And if there's any other questions further along, I'd be glad to answer them. Thank you, Nancy, for your intervention. I'll try to be as brief as possible. A topic that is a strong passion of mine has to do with focusing on studies, studying the families, but not just traditional families, but also diverse families, LGBT families. In this sense, a challenge of ours is solving how LGBT families are being exposed by the COVID, as they're in worse conditions than before. This is issues with enrolling children from LGBT families, issues to register children that are born within these family units. They're families that are already built. We have to be able to guarantee the same rights to them. That is an issue and a topic that in the city of Buenos Aires we have solved. Since we approved equal marriage rights, it's a population that is no longer, if you want to refer to it this way, no longer a minority. We have to be able to guarantee their rights, demand rights and laws for them. Regarding academia, I don't want to be too critical or for this to be taken completely critical of academia, but in government, we want academia to be a nexus between civil society and the state, but also find a link between academia and other actors. Because as Nancy said, ideas exist, studies can be made, but they don't get to the people who have to see them. So we can go to panels, to congresses, we talk there, we say there what we visualize. Academic formation also has a sociological background. Oh, that's as far as we go. We have to be able to do more. We have to be visible. We have to be able to sit with the decision makers and also with civil society and have a double check mark to ensure that what we study is effective, and then in conjunction between civil society and academia, do lobbying with the state or political actors, so we can reach the political policies that we need, public policies that we need. So I'm an ally in that sense. If there's any questions, we can answer them.
Muchas gracias, Rocío, por tu participación. Y ahora pasamos a Juan Manuel.
There's a little time for me, Christian, but okay. Greatest challenges that we have faced. I'll start by saying the best that we've had so far is the enormous commitment from our medical staff in all the countries that faced for over a year alone with no sort of defense against the pandemic, to protect our people, our armed forces, and our national police. All three of these groups are absolutely extraordinary people, and thousands of them paid it with their lives, with no sorts of protections, I insist, to do their work. If I'm forced to talk about obstacles, I have to sadly talk about our state. That distrust towards the ability of the private sector is still existent in the government. In terms of logistics, associations, oxygen, etc., there's no knowledge on the importance of the communication role against the pandemic. We had to fight against the resistance against vaccinations that we have at this time throughout the world. The inaction of many departments, like the Secretariat of Health, the lack of knowledge of the state on how to manage a crisis of this scale. Institutions were unable to manage a coordinated effort, unlike, for instance, how the United States or Israel or other countries solved this issue. An inability to make public data public in a single system to map and locate the populations that need tending to. Despite us in the private sector offering at different times and freely this data, the urban data is very old. It makes it very difficult to plan. We will go to X Street, and when we get there, there's 50,000 more people than initially expected, so that makes planning very, very difficult. There was a certain fear to talk to other departments in the government, such as the armed forces, and there was and the health ministry was unable to have any sort of implementation logistically. These are some of the obstacles I would mention, and that's just based on my fighting experience. We've been in the trenches fighting this crisis, and that's what I can tell you about it. In terms of academia, it would be magnificent if we could tell the state about implementing a centralized command center. There can be no program or any sort of military implementation if there's no center of command and control. Same goes with private companies. When there's a crisis, a center of command and control is open to centralize information and decisions. Just having just-in-time information so decision makers can take decisions or make decisions. Managing information with a single voice and proving to the state that it's important for there to only be one main voice, not 4 or 5 people who spread information, can at times offer contradictory information. Having a communication strategy that is a nationwide strategy that reaches people throughout the country. Our country has 52 different dialects. It's very difficult to communicate. And we must consider massive media. Digital media only reaches young people, relatively young people. If we want to reach older people, we have to use other strategies. And that's what we've been doing with mass media. Looking to the future, we have to improve our reaction times to disasters. Talking about earthquakes, our tests don't work. We have to work with families to act on these earthquake tests or trials, preparations. We have to have geotraceability to design health policies in case of any natural disaster. Thank you. Thank you for your intervention. I think it's been an excellent conversation. We've learned a lot about challenges. It's a sign that there's still a lot that we can work on. We now have an overview of what's happening in Latin America, in different countries, and within the COVID-19 context. If any of you have a specific question, that you can ask it in the Q&A chat. So we have a question from Diego Macal. The pandemic exposed. Where's the question? So there's problems with internet to work, but not all Latin Americans have access to the internet. Yesterday, Facebook, WhatsApp fell, affecting all sorts of commercial businesses. So what can we do in Latin America to guarantee 100% access to the internet? Or at least for most people. Does the panel know of any effort to develop internally any software or infrastructure to have internet in Latin America? Would anybody want to talk about this topic of internet access in Latin America? I'd just like to say that progress varies from country to country. There's obviously a goal of my work with government, and we aspire to have absolute 100% internet access, but there's a lot of obstacles along the way involving financials, having the right alliances and the right strategies to reach this access. It's still very deficient. I would say there's good progress in local governments. In local governments, there's increasing and improving experiences of having internet access in a public plaza, in a library, or in certain gathering areas. But that's at a very small communitary level. That's where we see very interesting projects in Argentina and in other countries. As Batilde said, the city of Buenos Aires, public plazas, there's internet access. But as was asked about in general for Argentina, I'd just like to say a week ago, I was in Quiaca, which is the frontier limit between Argentina and Bolivia. I did all that trajectory back and forth because that's where you can really see the reality of Buenos Aires in metropolis. The truth is, we also have problems in Latin America involving how our country is distributed. We have countries, or we have regions, mountainous regions, where infrastructure for the internet to reach them is very limited or it's very expensive. Today, Latin American countries don't have the budget to undertake or create those infrastructures. Regarding the question specifically, is there any Latin American or Argentina software? We don't have any homemade software. We lack engineers, so we're not developing any software or anything of the like. Well, I can say something brief about this. It's not just a financial problem. Peru is a very diverse country. In our rural areas, in the Sierras, in the mountains, is very hard to get to. We need to work a lot to access these areas. But an initiative that has had that the social inclusion ministry has had is creating spaces with internet for students to access and the community who wish to use them or digital processes to be able to use them. Hey, Christian Juan Manuel, remember this? But it's a measure that's been slowly implemented, and the population don't have access to the internet, which is rural areas. It's not necessarily them not having access to a phone, but this is also true on the coast of Peru. Those are different issues. Maybe they have a different type of phone, maybe they have prepaid phone, and they don't have access to social media or access to educational resources. So all of this evidence has to be gathered to attack the issue in different areas and regions. We're talking about the tambos, Nancy.
Nancy, ¿no es cierto? Tambos que forman parte del programa País que tiene los tambos y las plataformas integrantes.
Internet is a medium. There's other mediums. If you want to talk to people with 70 or older age old, well, internet's not the way to reach them. We have to think strategically in terms of communications to reach everybody. People older than 60 or 65 are the most vulnerable in terms of COVID. We have to convince them to vaccinate themselves. There's no way we can allow for them to not be vaccinated. If the state is only using digital media to communicate, then there's a huge segment of the population that never realized that they could already get their vaccines 2 or 3 blocks down the street. And to tell them to rush there, so otherwise they won't reach or get a vaccine. So the communication professionals evidently have to create the communication channels. But it's not just internet. There's many other ways that we can use to achieve the goal of communication, which is huge. Thank you, Juan Manuel. Thank you for your intervention. Thank you, everyone, for your intervention in this conference. It's been very enlightening, the information we have received from all of these different sectors. Any ideas, any projects to develop from this reunion. Thank you, everyone, for being in this participation. Thank you, Rocio. Thank you, Nancy, Juan Manuel, Batilde. Thank you for giving us some of your time to be with us. And thank you to all the participants. Please remain connected because we'll have new or different participations. Goodbye.
Gracias, buen día a todos.
Muchas gracias, hasta luego, hasta la próxima.